Hello, my name is Yulia Jabovskaya. I attend Frostburg State University, and today I will be doing a presentation on health promotion for contraceptive use. For my clinical, I attended Potomac Family Planning here in Rockville, Maryland, and I had the opportunity to witness and support women during their abortion process. And during this time, I did learn that how important contraceptive use was and how important providing education on safe intercourse was necessary. So a little bit about what is contraception. So for some people, this may mean complete abstinence, but contraception is referred to the prevention of fertilization between egg and sperm to create a baby. So methods of contraceptive use could be abstinence, condom use, medicine, implant, as well as sterilization of either male or female organs that essentially just prevents conception. A little background about contraceptive use. According to Healthy People 2020, about 82% of pregnancies to mothers between the ages of 15 and 19 were unintended. A little bit more about that statistic. There were approximately 600,000 legal abortions reported to the CDC in women between the ages of 15 and 44. So what we can see here is that there are a lot of young females that do get an abortion, and the reasons for those that have unintended pregnancies could be low amount of education on the topic, incorrect use of the pill, and just not knowing enough information on the importance of contraceptive use. And here listed were the reported reasons for unwanted pregnancies. Some just have not had protected intercourse as well. So a little bit about why contraceptives are important. So not only do they prevent pregnancies and unintentional pregnancies, they can also prevent the risk of having an STD, STI, or an infection. UTIs are very common. Chlamydia, gonorrhea, those infections can occur from not having the protective layer between male and female. That could be referred to as the condom. Now, not all birth control methods can prevent STDs, but they do support that. Another reason why it is important is because it does help with pregnancy timing. For mothers that do want children, they can use birth control as a method to have a child at a time that is right for them, or conceive at a time that they are financially stable or are able to have a child. Risks to having an unwanted pregnancy and unintentional pregnancy at an early age are very high. A lot of women don't really consider these as risks, but according to Healthy People 2020, having an unintentional pregnancy puts the mother at risk for delay in prenatal care, reduced likelihood of breastfeeding, as well as maternal development. Depression is very common to mothers that have unwanted pregnancies. And what was interesting was that only 30% of females were reported to have pre-pregnancy health care, meaning that only 30% of women were being educated on birth control, were being educated on the importance of prenatal care, the importance of follow-up appointments, and that could be due to the early age that females are becoming pregnant. That could be due to having a baby at a time that one is not ready to have one, which is why a lot of females do use the abortion option. So types of birth control include abstinence, the birth control pill, condom use. There are implants such as the IUD, as well as Nexplanon. So here I have a picture of the uterine device, the IUD. This is a form of birth control that is inserted by a physician. It could be inserted at a primary care office, at an OBGYN. This is reported as 99% effective in preventing unwanted pregnancies, or preventing pregnancies in general. Also, it has been found that the copper IUD is really good at preventing pregnancies the next day. So say someone had an unprotected sex, and they do not want to be pregnant, do not want the child, they can go to their physician and get the copper IUD inserted within about 36 hours after intercourse. The next one here I have is the Nexplanon. This is a hormonal implant that is put into the fat tissue in the upper arm. This is good for about 3 to 5 years. This can also be obtained at a primary care office, OBGYN. Also, Potomac Family Planning does provide birth control pills, as well as the injection of birth control. So where one may get contraceptions, as mentioned earlier, any female can go to their primary care, can go to an OBGYN and request to have a prescription for birth control. Of course, one will talk with their physician on what methods there are, the types of birth control, the hormonal levels within each birth control that may best suit them. The next best thing is condom use. Condoms can be purchased at Target, at CVS, Walmart, pretty much any store, and they can also be obtained for free. For the younger generation, it's very important to tell them that they can obtain condoms at their nurse's office, at their physician's office, at Planned Parenthood, even at Potomac Family Planning. We have condoms here all the time. They're very accessible, and handing them out to teenagers can encourage them to use them, since they don't have to pay for them, or they will already have them on hand. So promoting contraceptive use, methods of promotion would include formal education to adolescents as well as women. So a lot of public schools here within Montgomery County do offer education on safe sex, intercourse, and contraceptive use. I think the education needs to be emphasized more. It needs to be more accessible to females. A lot of girls at a young age can be nervous to ask about contraceptive use and where to obtain it. So a great resource could be the school nurse. Every school has a school nurse, and just walking to her and asking questions can help a lot of young adults. Another way of promotion for contraceptive use would be early intervention by primary care. This can include the physician, nurse practitioner, physician's assistant. Anyone that comes in contact with a female has the opportunity to provide education if they're willing to listen. Now again, this discussion should be initiated at the early ages between 11 and 16. And reinforcing this information will also be helpful in terms of health promotion on contraceptive use. Now, from a nursing standpoint, promoting contraceptive use is also very important on our end. Any female that we come in contact is a great opportunity to ask questions on what they know, what they don't know, if they're even comfortable. I think it could really benefit the community just to have that conversation, to provide resources to young adults. So these are my references on the